All right, well, away from that, the Kenyatta National Medical Practitioners, Pharmacists and Dentists Union today held a press briefing on the state of health in the country. Ibrahim Karanja was there and is now joining us live for more details. Ibrahim, a very good afternoon to you. Good to see you. What are some of these issues that was brought up by the union?
Well, good afternoon, Zainab. The KMPDU has largely focused its press conference here on the death of Trevor Maina in Kenyatta National Hospital. Remember that young boy who had a fork jembe lodged in his head, and the KMPDU just weighing in on the matter and stating on exactly where the problem could have been. They say that whereas all the blame is currently headed the way of the Kenyatta National Hospital, the problem is bigger, and the country should not only be treating the symptoms but the actual problem. And right now I'm joined by the Secretary General, Dr. Davji Atela of the Kenya Medical Practitioners and Dentists Union. Dr. Thank you so much for speaking to us. You're live on NTV, and you have weighed in on the death of young Trevor Maina and actually on where the problem could have emanated from. Perhaps to give our viewers a highlight of what your view is as the KMPDU.
Thank you so much, Ibrahim. And as a union, we really condole with the family and the friends of the young boy who lost his life. But then we come up to check on this matter from the point that this incident happened, where the boy got an accident with jembe, and then was at a dispensary and then referred to a level 5 hospital. Ideally, many of these cases occur in the country. We have seen many accidents happening in different parts, in Kilifi, in northeastern, in Nyanza, and every part. But then we have our healthcare at devolved function, where we have levels of hospitals. We have the first point that this matter was prescribed to be Thika level 5. And our level 5 hospitals actually ought to have a neurosurgeon, ought to have an anesthesiologist, ought to have different specialties and an ICU. But we look at it at this point that once this patient was presented here, then again he had to be referred to Kenyatta National Referral Hospital. To us, we think that shows a dysfunctional public healthcare in this country, whereby every part of the country, we do not treat these matters in the place where they should be, because the ultimate reason for devolution was to make emergency care and care available to the people. We should not have a facility named a level 5, but then the public walks in and cannot get the care they need because there is no mixed personnel that are required, because there are no infrastructure, or because there are no the drugs that are needed. So this is coming to one of the examples, because we may have an outcry as we do because it's a sad situation, but we need to look at how can we eliminate such cases from occurring in the future, not only from Kiambu, but from every part of the country that has a level 5. And this now needs to have the governance, like Brother Wamatangi, to come out and check that if they do not have the emergency services, they do not have the specialists that are needed. If another case occurs today in Kiambu, again to land in KNH or QCHRH or MCHRH. If another case occurs in Migori or occurs in Kilifi or Kwale, then the same thing will occur. Therefore, we need to have a solution to healthcare where Kenyans can actually go to hospitals and get treated, not just referral systems.
Thank you.
Both in the counties and the national. Yes.
Thank you so much, Davji Atela there, the Secretary General KMPDU. Allow me to speak to the chair. And the SG is talking about counties being ill-prepared to handle such situations, and if it's not treated, then unfortunately we might end up seeing this. Very briefly, where do you think the solution lies then, so that we do not see situations such as that of Trevor Maina again?
Like I've said, and I'll reiterate again, we can't have one unified country with a system as critical as healthcare run in 47 different ways. If that was to happen in the security sector, that you have 47 different security apparatus, and in the education sector that you have 47 different ways in which our children are going to school in 47 different countries, there will be an outcry. Same applies to healthcare. The lack of capacity building in the counties is not a problem of their own making, in my opinion, simply because there has been no adequate resources allocated to those counties as to be commensurate to the needs and demands there. That to say that the national government has the single most important role, according to Schedule 4 of the Constitution, to issue policy and guidelines. And those policy and guidelines to the counties involve staffing norms, that a level 5 hospital should have a neurosurgeon and all the required specialists to tackle such cases. The delays that you're talking about is purely due to shortage. Again, we commensurate with the loss of the child.
Thank you so much, Chair. Well, Zainab, you have heard it from the officials of the Kenya Medical Practitioners and Dentists Union, KMPDU, speaking about this challenge, saying that it goes beyond the case of Trevor Minor and to actually is a case that affects various other counties in the country. And this is a conversation that we will take forward. Now that the KMPDU is bringing the battle to the doorstep of governors, we will want to hear from the Council of Governors, the Health Committee. What is it, or how will they respond to this issue in terms of them lacking in capacity to provide health services, yet health is fully devolved? Zainab.
All right. Thank you, Ibrahim Karanja, for that. Certainly we'll be looking forward on the developments from here henceforth.